Thank you very much. Somebody asked that what if human papilloma virus is present? So I'd like to address that with a video. Basically, the pap smear is a screening method for cervical cancer. It's a procedure that is basically used to detect for the presence of abnormal cells in the cervix, which is the entrance into the womb. And while doing this, part of the cells are taken and also tested for human papilloma virus, which is the main cause of cervical cancer. So two things are done. We check for the nature of the cells around the cervix and also check for the presence of human papilloma virus in the cells. So how is this done? A particular instrument, which we call a speculum, is inserted through your private part to visualize the cervix. So while this is done, a small brush is used to take part of the cells around the cervix. So when these cells are taken, they are being sent to the lab to view them under the microscope. The function of the microscope is to make the cells bigger. So while part of these cells will also be tested for the presence of human papilloma virus. So we should also bear it at the back of our mind that human papilloma virus are of various types. They are the ones that are of high risk, the ones that are of low risk. So high risk means if this particular type of human papilloma virus are present, you are more at risk of developing cervical cancer than those that have the low risk. The high risk human papilloma virus include the 16 and the 18. So we should get a pap smear done. Typically, any woman of reproductive age group, typically above the age of 21 years, should get it done. And this is being done based on the screening guideline. From 21 to 29 years, it can be every 3 years. From 30 to 65, it can be every 5 years. Then 65 and above, you might not need to do it except you detect abnormal cells around your cervix. Pap smear is basically used to detect for early changes of cervical cancer. So that when this is found, treatment will be instituted as soon as possible. Now to the results. I told us that there are two things that we are checking in pap smear. We are checking for the nature of the cells and also checking for the human papilloma virus. So there are two things. The human papilloma virus can either be positive or negative. Positive means they are present. Negative means they are not present. While the nature of the cells can either be normal or abnormal. If the cells are normal and the human papilloma virus is negative, that means the individual is safe. They need to continue routine screening as indicated. However, if the cells are normal and the human papilloma virus is positive, we now look at the types of human papilloma virus. If it is the high risk human papilloma virus, which is the HPV 16 and HPV 18, you need to do a procedure called colposcopy, which I'm going to explain after this. If the cells are abnormal in nature and the human papilloma virus is negative or absent, that individual may still be recommended to do a colposcopy. If the nature of the cells is abnormal and the human papilloma virus is positive, that means it is present, that individual must do a colposcopy. So what is a colposcopy? Colposcopy is a more magnified imaging whereby an instrument is being used to take a closer look at the cervix. This helps to enlarge the cells of the cervix in order to detect the abnormal cells and also take part of it, which we call biopsy. So a biopsy will be done to take part of those cells and check them under the microscope for the nature of the cells. So this is to detect early cervical cancer changes of the cells. If the colposcopy is now done and the biopsy too is also taken, the result now happens to show abnormal cells, or they are confirmed to be cells that can change to cancer, or they are confirmed to be cells that are cancerous. Then treatment will be started. There are various options of treatment. It will either be watchful waiting if it is not affecting the life of the individual. It could be surgery to remove the cells, and then many other forms of treatment which can be instituted for that individual.